Today we are going to talk about a diabetes ulcer. This one describes a slow healing wound that commonly appears on the feet. It is a complication of diabetes that often stems from a lack of sensation or blood flow in the affected areas. Without treatment and management, it can result in severe complications. Diabetes is a condition that affects a person's blood sugar level due to how their body produces or uses the hormone insulin. Individuals with diabetes are unable to either efficiently use or produce sufficient insulin, leading to high sugar levels circulating in the blood. Diabetes ulcers are a potential complication of diabetes. They typically refer to an open sore or wound on the skin that cannot heal. A diabetes ulcer will often be denied as minor trauma. However, due to a combination of factors such as nerve damage and slow healing, a person may not notice their injuries and it may progress into an ulcer. There are three main types of diabetes ulcer. First, neuropathic. This one develops due to peripheral neuropathies, meaning a person lost sensation and cannot feel pain. Second, ischemic. They usually develop due to ischemia, which occurs when part of the body does not receive sufficient blood flow. Third, neuroischemic. This refers to one developing from both neuropathy and ischemia. Cause and risk factor. Common cause of diabetes foot ulcer include first, high sugar level. Second, peripheral neuropathy. Peripheral neuropathy describes damage to the peripheral nerve. These are the nerves outside the brain and spinal cord that relay information between the brain and the rest of the body. High blood sugar level can damage this nerve, causing varying degrees of numbness, tingling, or burning in the extremities such as the feet. For example, a person may acquire an injury such as a blister, but not notice it due to not feeling pain in their feet. This may result in the wound not being treated, causing it to worsen and develop into an ulcer. Additionally, damage from high blood sugar level can also increase the risk of conditions that affect the circulatory system, such as peripheral artery disease. The condition can resist blood flow and result in poor circulation, making the foot less able to heal and fight infections. Other risk factors of diabetes ulcer may include first, older age. Second, longer duration of diabetes. Third, smoking. Fourth, obesity. Hypertension. Six, poor circulation in extremities such as the face. Seven, inflammation. Eight, change in white blood cell count. Where do diabetes ulcers occur? Diabetes ulcers commonly affect the feet. They most occur in the weight-bearing area of the foot, such as the ball of the foot, heel, and tip or bent toe. While most diabetes ulcers occur on the feet, they can also develop anywhere else on the body, including the leg, hand, and fold of skin on the stomach. For example, hand conditions of diabetes are rare compared with foot. Symptoms and diagnosis. An ulcer is an open wound typically deep enough to see the underlying tissue, sometimes even the bone. A doctor will inspect the ulcer, noting its location, size, depth, and wound discharge. This would include swelling, hardening of the skin region. The doctor will also try to identify the position of ulcerations and which factor may contribute to its development. Experts use different classification of diabetes foot ulcer is classifies ulcer as grade 0, skin intact, but the foot is at least grade 1, superficial ulcer, grade 2, deeper ulcer, grade T, deeper tissue involvement with abscess or osteomyelitis. Grade 4, portion of the foot is gangrenous. Grade 5, extensive gangrenes involving the entire foot. Treatment for diabetes ulcer. When someone identifies an ulcer, they should seek medical care to prevent its progression. The primary goal of treatment is to promote healing as soon as possible. Treatment will often depend on the grade of the ulcer. If an infection is present, a doctor will likely prescribe antibiotics. This may require tissue sample to identify the cause of the infection. The antibiotic type and dosage a doctor suggests will depend on the infection organism and the severity of the infections. In some cases, surgical options may be necessary to help encourage healing, relieve pressure on the area, and prevent further complications. The often may include first, debridement, remove of damaged tissue. To prevent ulcer includes keeping the feet clean, moisturized, and dry, wearing shoes that is fit correctly, checking the skin daily for any blister, crack, cut, ingrown toenails, and other minor injuries, keeping sugar level with target range, not walking barefoot, seeing a podiatrist for any injuries, quitting smoking if applicable.